It's exciting that another population, this last segment of the population, has access, and it's an important conversation to have. Again, somewhat for the kids, but more for the adults around those kids.
The White House predicting kids 5 and under may be able to get their first COVID-19 vaccine dose before the end of June. The FDA meeting later this month to make the call. If approved, Moderna and Pfizer doses would begin shipping out to doctors' offices and pediatric care facilities.
Now we have a way to protect those kids and protect them from spreading it.
Dr. Bobby McCamala, a Flint area physician, says kids, although less likely to be severely impacted by a COVID infection, are vectors of COVID-19.
Even though the risk is low, having them get infected and shedding that virus to grandparents, hanging out with them in the summertime or babysitting them, that sort of thing, puts other people at risk.
He acknowledges some parents may be skeptical of vaccinating their very young children.
What's the point of getting the vaccine? Why not just let them get sick, just like chickenpox? We used to do that, but it's really the same answer. The risk of chickenpox infection versus chickenpox vaccine, it's more risky to have the infection. It's the same thing with COVID.
Some parents on the TV5 Facebook page sounding off in the comments. Don Giuliani says that's a big no for my children and myself. Nancy McGarry relieved, commenting, "Thank goodness." But Dale Janis says, quote, "It's causing myocarditis in the young and old."
The risk of myocarditis is something that, a lot of people have heard about, but it's very rare. In fact, the risk of myocarditis from the infection is higher than the risk of myocarditis from the vaccine.
Pfizer says its child-sized dose would be 3 doses at 1/10 of the adult dose for kids ages 6 months to 4 years. Moderna's would require 2 doses at 1/3 of the adult dose for those between 6 months to 5 years. For WNEM TV5, I'm Kendall Keys.